You're listening to Idaho Matters. I'm Gemma Gaudet. It's not easy to go to the doctor if you speak a different language. But what if you're deaf? How do you communicate? What barriers need to be overcome for a simple doctor's visit? St. Alphonsus is working with the Idaho Council for the Deaf and Hard of Hearing on programs to help with these issues. After a grant from the St. Alphonsus Foundation and 2 years of work, St. Al's has American Sign Language interpreters, remote interpreters, and even a kit that hospitals and clinics can use to help people communicate. Joining us live in studio today to talk about these programs are Deirdre Lattin. She is a nurse in the St. Alphonsus Family Center. Stephen Snow, he is Executive Director of the Idaho Council for the Deaf and Hard of Hearing, and Lauren Seal, who is interpreting for Stephen today. Welcome all of you to the program.
Thank you.
So I want to start with this. There are close to 100,000 people just in the Treasure Valley with some kind of hearing loss. So, Stephen, what have you noticed an increase of in people with hearing loss in our area? Why do we have such high numbers? Do we know?
That's an excellent question. Deaf people and hard of hearing people, honestly, that disability is invisible. There isn't a visible marker for those who are deaf or hard of hearing, unlike a person who uses a wheelchair. Oftentimes, that number is misconstrued. Of course, people who use hearing aids are noticeable, but for that population, generally about 13% have a hearing loss. And there is research that shows that up to 20% of those people have a hearing loss.
So what's interesting with that, I've never considered it being something that is invisible. And I even had a brother who was deaf, but we all knew it within our family. So I don't think we gave it much thought. However, I'm thinking of even beyond a doctor's visit. I mean, going to a grocery store, anywhere that you are in the world, people don't necessarily know that you have this hearing loss. So this is something you deal with on a daily basis in the community of the deaf and hard of hearing.
That's correct, every day.
And what's that like?
That's a great question. Many people think that deaf people are rude, honestly, because they will say, hey, excuse me, and the deaf person won't turn around or won't respond. And then they realize, oh, it's because they're deaf. Or they will, it will be like a deer in the headlights, where they will say, oh, this person is deaf. I don't know how to function now. I don't know how to communicate. And that experience is common throughout Idaho for deaf individuals. I often will tell them, it's okay. I'm human. I'm just like you. We can figure out how to communicate. You don't have to be scared. When hearing people are involved with the deaf community, they get used to it. But that initial reaction is very common within deaf and hard of hearing people in Idaho.
And Deirdre, I want to bring you into the conversation because as Stephen just said, I mean, it is that idea that deaf people are rude or people are like a deer in the headlights, right? I mean, I experienced that within my own family with having a sibling that was deaf. So is this partly where this program comes from? Because I can't imagine doctors and nurses trying to communicate with someone if they don't know how to sign.
Right. It is very difficult. So that's why we wanted to improve our services at St. Alphonsus, not only to help our clientele, but also to help staff and providers to make the transition easier and ensure that needs were being addressed and good care was being provided.
So how are you doing that with these new programs?
Okay. We partnered with the deaf and hard of hearing community. We created an advisory council that has brought in members of the deaf and hard of hearing community, staff, some of our IT personnel, previous patients at the hospital, and management. We've also acquired interpreters, and we've sat around and discussed what issues we're having, where the barriers are, and how we can improve these services. And so some of the things we've come up with, we have video remote interpreting, which is a laptop that has access to an interpreter within 10 seconds. And we partnered to find out a good vendor that provided good interpreting to our patients based upon feedback that was provided by our deaf and hard of hearing community. Now, I want it to be understood that St. Alphonsus believes that a bedside interpreter is the gold standard. However, sometimes there are situations where there's an immediate need for an interpreter, and so video remote interpreting allows this.
And Stephen, what's that like for you and for the deaf and hard of hearing community to frankly finally be heard when it comes to your own health care?
First, I want to recognize St. Alphonsus for their continual commitment. The result of their effort of establishing that relationship with the deaf community has resulted in very positive feedback from the deaf community. I have heard many comments that deaf and hard of hearing members feel very valued at St. Alphonsus, and they are receiving the care and services that they need. I also want to applaud St. Alphonsus for establishing their advisory committee. That's the first of its kind in the entire state. There are no other healthcare systems that have that type of relationship with the deaf community, so I applaud them for that. And they are setting the precedents for other hospitals to follow.
We're talking with Deirdre Lattin. She's a nurse in the St. Alphonsus Family Center, Stephen Snow, Executive Director of the Idaho Council for the Deaf and Hard of Hearing, and Lauren Seal, who is interpreting for Stephen today. Our topic today is barriers for the deaf and hard of hearing in the healthcare industry. Stephen, have you found within the deaf and hard of hearing community that before a program like this, people maybe were not getting the health care that they needed? And I ask that because it's got to be frustrating, because you either have to have someone come with you who can communicate and then who can interpret, or has it just been easier to stay away from these services because of the frustration?
Yes, that's an excellent question. A large percentage of the barriers that exist for deaf people is that willingness to go in for health care. They often know that once they arrive, their experience is going to be frustrating and they are not going to get the information they need. So they will then rather just deal with the issue they are having instead of dealing with the systemic issues. So oftentimes they will put off getting their medical needs met. And if they arrive, oftentimes the office will say, you are supposed to bring a family member as your interpreter. Why didn't you bring your parent or your sibling to interpret for you? And at that point, often they are rejected from the office, and they have to hop from 2 to 3 doctor's offices to finally get an appointment. Unfortunately, I've heard many stories of how the system has created barriers for deaf and hard of hearing people to receive quality care. And personally, I have experienced that as well. And I understand that people, it's not out of intentional oppression. They just need that education opportunity. If I can provide them with those resources, I'm hoping that it will make an impact, and then hopefully will have better problem-solving skills in the future for when they have other deaf and hard of hearing patients.
Go ahead, Deirdre.
Along with this partnership, things that we've been able to improve for those reasons, the video remote interpreting, the advisory council committee meetings that we collaborate with one another, but we also have we've created a training for our staff members so that we're not dealing with that. How do I approach a deaf client or a client or a patient who has family members who are deaf? So we have various little kits that offer little placards on how to enter the room. And so we have annual competency education. We have these deaf and hard of hearing kits. And we've also started a new program for childbirth education, breastfeeding, newborn care and parenting that we have hired onto women who are deaf, and they're educators, they're certified, and they are teaching our classes in American Sign Language.
Well, and getting back to your point, Stephen, about this idea that that saying like you need to bring a family member, a parent, or someone else within your family to interpret. There are family members who may not know sign language. This has only been something in like the last, couple of decades where it has been something within our culture that you should learn sign language. So there are families that even if there's a deaf person in the family, you may not know sign. And do you run into that as well?
Definitely. That is one of the reasons we recently passed an interpreter licensure law that was passed last year. So that has been in effect for a year, requiring sign language interpreters to be licensed. And that way, hiring entities will know that they are qualified enough to be able to access the patient and provide information. Oftentimes, people believe interpreters are for deaf people, but they really are for both. The patient needs to access the information from the doctor, and the doctor needs to access the information from the patient. So that's why interpreters for the deaf is not the appropriate phrasing, but really it's interpreters for both. And I'd like to emphasize that. And thankfully, interpreter licensure is now a quality standard to showing that they are qualified to be there, and it helps protect liability.
And Deirdre, final question for you. What has this been like for doctors and nurses? Because I love what Stephen said, that interpreters are not just for the deaf. They are for hearing people as well.
Exactly.
And potentially like taking you out of that, as Stephen said, deer in the headlights kind of moment when you walk into the room.
Yes. I've heard from providers how appreciative they are of having an interpreter available to them so that they can address the needs of the patient right away and handle things. I've heard some great feedback also with knowing that the kits are available to offer little picture cards and additional training to them so that they're not just walking into a room, but they know to flick the lights on so that our deaf patient knows that somebody's coming in. Versus all of a sudden this person just popping up in front of them. And so, yes, it's been very helpful.
But see, simple things like that if you are a hearing person, you don't think about.
You don't.
Like, well, if I walk in the room, they'll know I'm in the room.
Right. They'll hear the door click or something.
Yeah.
Yep.
I want to thank all of you for coming in today. An important subject to be talking about, and kudos to our healthcare community for doing this. We've been talking with Deirdre Lattin, a nurse in the St. Alphonsus Family Center, Stephen Snow. He is the executive director of the Idaho Council for the Deaf and Hard of Hearing, and Lauren Seal, who has been interpreting for Stephen today. I want to thank all of you for coming in.
Thank you very much.
Thank you very much for having us.
Up next.